Good evening, everyone. Thank you for tuning in. Good evening. Thank you for coming, and we really look forward to talking about cannabis policy in Massachusetts, and we're glad that you're excited to learn more about the bills that are moving forward in Massachusetts. So please feel free to ask questions. If you have questions, let us know, because we're happy to answer them, and we want to make sure everybody's informed and able to advocate for the policies that we want to see happen in Massachusetts. So I'm going to go ahead and get started in just a minute, but like I said, we're really excited to have our first webinar of 2024 and get everybody ready for exciting next few weeks of advocacy and at the Massachusetts State House. So why don't we go ahead and get started with our presentation. Oh, let's see, there we go. So we titled this presentation, Unlock the Future of Cannabis Policy in Massachusetts. And if you're streaming on Instagram, you may not be able to see the presentation, but you should be able to see it if you're on Facebook or YouTube. So follow along there if you want to see the presentation, but otherwise we'll give you a rundown of some of the topics that are on the agenda this legislative session, and we will talk a little bit about the legislative process. We'll also go over what recently happened at the State House. Lawmakers actually passed several bills out of committee, and we'll talk about those bills, where they ended up, and we'll go in depth and look at certain bills, the language of these bills and what they mean for our community. And finally, we can go into how you can help these bills to pass and share your support with legislators. So let's start with our introduction. So first, I just want to introduce myself. My name is Jeremiah McKinnon, and I'm the President and Executive Director of Massachusetts Patient Advocacy Alliance. We're the group that represents the coalition that helped draft and pass the ballot initiative in 2012 that helped legalize medical marijuana in Massachusetts. And for over a decade, we've continued to represent patients and connect with lawmakers, regulators, as caregivers, physicians, wherever you may land in the spectrum of interest here, that you're up to date on what's going on with cannabis policy in the state. And we want to arm you with the tools and strategies to effectively advocate for the policies that will impact patients and move our industry forward. Those are Good Chemistry, Medwell Health and Wellness, and Happy Valley for their dynamic. You might wonder when you can talk to lawmakers and when you can, when do they work and when do they not work. So when we think about when we can reach out to lawmakers, it's important to understand how Beacon Hill operates. So the session occurs every 2 years, beginning on odd-numbered years. So the session that we're in right now actually started at the beginning of 2023. And all of the bills have to be introduced by the third Friday in January of the beginning of the session. So at the beginning of the year for these sessions, all of the lawmakers are pretty much preparing their bills, filing them, and making sure that they get into the session this year. And once a bill is filed, before it's filed, it needs a sponsor. So in order for any bill to be moved forward, you have to have a representative or a senator who will take this issue up and move it forward. And once that sponsor files the bill, the clerk will review the bill and send it to the appropriate committee within the State House. And there will be a hearing held at a certain point where you can have public comment and there's a period where you can send in written comment the bill, and they take some time to do that. But in between the time when the bill is filed and when the deadline is to file it out of committee, lawmakers do have the opportunity to co-sponsor the legislation. So that essentially is signing on in support of the legislation. So the more co-sponsors that a bill has, it signals momentum, it signals support within the within Beacon Hill. So the more co-sponsors a bill gains, it grabs attention of the committee members. And so when the beginning of the session happens, that's usually a time for constituents to reach out to their lawmakers and let them know that they want them to support this bill by being a co-sponsor. But at this point, it's 2024, and we're in the second year of the legislative session here in Massachusetts. So with that in mind, we have to take a look at where the bills are and reach out to those committees. We sent a study for further consideration, or they can oppose or reject the piece of legislation. So it's important to know what bills are currently on the table that have the greatest chance of passing, and that are cannabis bills, so we can understand what the bill would do. So our next slide talks more about what is happening now. So as I mentioned, the Joint Committee on Cannabis Policy recently advanced several cannabis bills, and those bills must now be reviewed by the committees that they've been referred to. So around the middle of February, there was a deadline for committees at the State House to send their bills out of committee. And so several cannabis bills moved forward, which is a good sign, and several of the bills would make a positive impact. So we're glad to see them move forward. It's still early in the year in 2024 to reach out to lawmakers. Bills are on the radar, and that they can respond to our needs. So sharing your support as a constituent is really important, and it definitely can have an impact on the outcome. So advocating for cannabis reform is very important, and it's actually not as difficult as it may seem. And so tonight we're going to go through some of the strategies that, for effective advocacy and how to make sure that you're doing it right, and using some of the tips and tricks to ensure that, you can actually feel comfortable reaching out to lawmakers and, feel like you have an impact by sharing your expertise, your perspective. And so let's see, next we have a slide that, talks about the barriers to patient access. I think a lot of us come at cannabis from different perspectives, but from our perspective at MPAA, we hear from a lot of patients. And so these are some of the main focal points that we hear quite often. There's a lack of patient access in certain areas of the state, even though it's been over a decade since the law passed, including areas like Provincetown, Cape Cod, or the Berkshires. There's definitely not a lot of medical marijuana access in those areas, and so that's a problem that needs to be addressed. There are major barriers of entry in the cannabis industry that prevent equity within the medical cannabis industry, and that has resulted in zero equity businesses being operational as medical cannabis businesses in Massachusetts. So clearly there are still barriers in place that are making the medical cannabis system inequitable for businesses, and that limits the number of businesses that can serve patients and limits access. So we want to see it become a more equitable system in the state. Another issue is difficulty finding consistent access to medical focused products and strains. That one's pretty self-explanatory, but patients do complain that consistency is something that they'd like to see more of, and that sometimes the strain that they rely on or product, maybe it's a high dose product, is not there. And So consistency is important. Affordability is another issue that continues to, affect a lot of people. So affordability, housing protections for renters, also another key issue. A lot of those leases are very prohibitive, and so I think the protections for patients are canvassing about the fact that in Massachusetts, those hospitals or traditional healthcare settings normally will not allow cannabis patients to bring their cannabis on site, and they also won't allow them to use it while they're in the hospital setting. And so that obviously creates negative health outcomes for patients, and we want to be able to have patients be able to use their medicine and be accommodated, so that way they don't run into situations where they face greater healthcare negative outcomes as a result of not being able to access their cannabis when having a medical emergency. So that's a good short list of all of the major issues that we hope to address in the near future, and some of the bills this year actually do tackle some of these issues. So we're happy to get into it a little more and share some of these bills, so that way we can try to make a big change this year. So these 6 bills, or a combination of bills, are the ones that just recently made it out of the Joint Committee on Cannabis Policy. And these are the ones that we're going to highlight tonight because they impact on patient access and medical marijuana. And there were not a lot of other bills. There were a handful of other bills, but this is pretty much a good collection of the bills that did make it out of committee. And we're excited to share some of them with you to help educate everybody and get us excited to advocate for some of these changes. So first, we're going to look at H4409. And this is something that Massachusetts Patient Advocacy Alliance has been very supportive of for many years now. And the bill is titled An Act Relative to Vertical Integration Businesses. So for those who may not know, the Massachusetts medical marijuana rules require every cannabis business to grow their own plants, produce their own edibles and products, and they also must be the retail point of sale, like a dispensary. So you have to do everything in order to become medical. Whereas in the adult use rules, you can just be a dispensary if you want to, or just be a grower. So since 2018, 2019, Massachusetts Patient Advocacy Alliance has been advocating very strongly for for the state to revisit this vertical integration requirement, because, by requiring businesses to do everything from growing the product to selling it at a dispensary, you're making the barrier of entry cost so much to open a medical marijuana business that only the bigger companies with lots of capital can achieve that requirement. So you have very few small businesses, and we want to encourage small business and expand patient access. So this bill would direct the commission to establish license tiers that include separate license classes. Essentially, that it'd be separate licenses. You could just get a medical marijuana dispensary license, or just get a cultivation license, or just a manufacturing license. That's the big change in this legislation, which would eliminate that vertical integration requirement. And so it replaces the current definition of medical marijuana treatment center with a new term, medical marijuana establishment. And of course, that's an umbrella term similar to marijuana establishment, but a medical marijuana establishment essentially means any of the licenses that of a medical marijuana related business. So, that way we can say that a business has a marijuana establishment license and a medical marijuana establishment license. And we understand that we can figure out which type of license it is under that umbrella. But H4409 does something to try to combat the inequity in the medical cannabis industry by establishing a 36-month exclusivity period for social equity businesses to obtain these new medical marijuana licenses that are not required to be vertically integrated. So that's a major step in the right direction in terms of meeting the mandate to have an equitable industry and incorporate participation by those who were harmed by the war on drugs. So this is an exciting update. The Joint Committee on Cannabis Policy actually introduced that section to the bill. Formerly, 4409 was called H117. But the Joint Committee on Cannabis Policy made updates to the bill. Demand is going to exceed the supply that could be provided. So I think that's a great balance because we want to make sure that we're having an equitable industry that's inclusive and also responsive to patient needs. So 4409 would eliminate the vertical integration requirement and also really do something to rectify the injustice of having a vertical integration requirement and trying to say that we have equity in the cannabis industry when we really have these high barriers in place. I think it's time for the state to reconcile those differences and understand that it's time to implement equitable policies for medical marijuana businesses. And if we get rid of the vertical integration requirement, we can have more patient access because more businesses can open medical marijuana stores, manufacturing facilities. So this is a huge opportunity for the medical marijuana program to kind of expand into its full potential. And that's kind of why we titled this presentation "Unlock the Medical Cannabis Program," because we really see a lot of these old rules that are still in place as being so restrictive that prevent businesses from participating. They prevent patient access. And so we want to advocate for 4409, which is currently before the Joint Committee on Healthcare Financing. So that's where that bill was sent. And we look forward to sharing details with you about how to reach out to that committee and share your support for 4409. But I'm going to check really quickly and see if I have any comments or questions. If anybody has any questions, please feel free to let me know. I will try to answer them, but right now it looks like we don't have any. And we do have other bills here that we're going to look at, so let's move on. But I will, before we move on, say that MPAA is very supportive of 4409, and if you see us at any can this March, in a few weeks from now, we will be walking around and we may have postcards that to Beacon Hill lawmakers and support certain pieces of legislation like 4409 and ensure that we can unlock the medical cannabis program once and for all. So definitely come up and say hi at any can if you're there, and it's going to be a great time as always, so we look forward to it. But back to our presentation, let's look at the next bill, which is H4426, an act prohibiting employment discrimination based on the legal use of cannabis. So this is an employment protection bill, and we're very excited to see it come out. It was originally a bill that would have applied only to medical marijuana, but the Joint Committee on Cannabis Policy went ahead and kind of made it more broad, and they actually are seeking to update Chapter 151B of the Massachusetts General Laws, which is actually the law that deals with prohibiting discrimination in employment. So they want to add to the law that while safety-sensitive positions would be exempt, that an employer could not otherwise discriminate against individuals in terms of compensation, conditions, refusal to hire, just due to the presence of THC or marijuana metabolites in their system. Obviously, the individual or the employer, there should not be any, use of cannabis at work or impairment during work, I guess I'll say. So, but this is Chapter 151B is the law that many years ago an individual did sue, and the Massachusetts Supreme Judicial Court ruled that medical marijuana use can be covered under discrimination in Chapter 151B. It's a valid argument to essentially challenge an employer's decision if they believe it's discrimination. So that is an interesting development that H4426 would really establish within the law that prohibits discrimination in employment protections that would make it so patients and really consumers as well, in my brief review of this bill, would be able to be protected from the fact that they have cannabis or THC in their system. Obviously, cannabis stays in the system a lot longer than, say, other drugs, maybe alcohol or whatnot. Those drugs can be flushed out of the system pretty quickly, but cannabis THC is fat soluble, so it actually binds to our receptors, and it sticks to us much longer. So I think this is a good way to protect individuals from discrimination. Recognize that this situation with cannabis is different than other substances, and now that it's legal, there should definitely be protections for people, so that way they don't lose their job over the fact that they are a cannabis user using something that's completely legal within Massachusetts. So 4409 and 4426 are really, I think, the two shinings. We could all rally around some of these bills that would really have a big impact on patients across the state, because like I said earlier, it may feel daunting or hard to advocate for cannabis policy, but actually it's really not that difficult, and your voice can really change lives if we all come together and can move the needle on certain pieces of legislation, get certain policies enacted. We really can improve people's lives and make accessing medical cannabis that much easier. So we're interested to get the momentum continued with this legislative session. So moving forward with another bill here, this one is interesting as well. It's H104 and S2599. The two bills are pretty much identical. It's called an act relative to seeds. So it's really a small administrative edit that's being made. It essentially updates the language regarding cannabis seeds under Massachusetts Controlled Substances Act. Currently, both seeds that are capable of germination and sterilized seeds are within the definition of marijuana, but this bill kind of cleans up the language and maybe makes it a little clearer. So really nothing's changing with these bills, and I think that the reason why it's moved ahead is because it's it doesn't really have a big change of an impact, but it would just clean up the existing language and make it easier to understand. So it does. I think I do have the bill here somewhere. I can pull it up just so we can take a look at it. So it would essentially add, a small line that is clear, and it says the sterilized seed of the plant, which is incapable of germination, or the seeds of the plant that essentially can be germinated. So just instead of it being in two places that are not next to each other, it's just one sentence that covers it all. So pretty benign, and we just wanted to mention it because it was it's obviously growing at home is something that is relevant to a lot of patients and a lot of consumers. And so when you see an update to the law that would affect seeds, you might want to know what it's going to do, but I don't think that there's much to worry about here. And we just wanted to make sure you were aware of this one. So let's go ahead to the next bill, which is H122. It's titled An Act Relative to a Medical Marijuana Pilot Program. So this bill is pretty expansive, and it's got a big goal, which I will commend the bill and its sponsor for introducing it, because it's never easy to get something passed in Massachusetts, and advocacy is all about pushing for what is right and what we need to see. So I appreciate this sponsor in pushing for a pilot program that would really help veterans. So let's take a look at this one. It would create a mandate at the Department of Public Health to create a pilot program, and it would be called the Crosby Project, and it would be designed for veterans to use medical marijuana treatment for medical conditions that are currently addressed with opioid medicine. And the aim is to combat opioid use disorder. So let me go to the actual bill and show you that the bill would have, the program has 3 phases. During the first phase, the program would do its initial research and pretty much design the program. And the second section, the second step was to develop the necessary resources and staff and launch the program. And the third phase of the program is to evaluate the results and have data that can back up marijuana use and its relationship with combating opioid use disorder. So it's obviously something that would cost, there's funding costs involved with this, and it would have a big impact of us for research purposes, look more at, and I'm happy to have further discussions with everybody about it. Let's see if I have any questions about this one or any bills, please let me know. But the bill so far asks for a detailed report on the research findings to be submitted by December 31st of 2024. I think obviously that would have to be changed, or it would be a very quick research program. But obviously it's a moving target when you're filing a bill. You're never sure when it's going to get implemented or passed. So it's obviously a good target date and a good bill. And so I'm interested to see how the Joint Committee on Healthcare Financing deliberates on this bill, but focused on veterans. And this one is focused on veterans as well. The bill would amend the definition of debilitating medical condition in the medical marijuana law, and it would specifically include PTSD and opioid use disorder. And the second thing that the bill would do is update the definition of qualifying patient to allow individuals that are receiving care from the VA to use documentation from the VA that documents their condition as proof of their, in lieu of the certification that you would normally receive from a cannabis doctor. They would be able to use the VA paperwork that shows diagnosis, and that would gain them entry into the medical marijuana program. So this passed out of the Joint Committee on Cannabis Policy, and it's currently before the Joint Committee on Healthcare Financing. And the Commission last year did vote to signal their support for this bill. The Commission they have a process called their statement of policy, and they can vote to essentially align with a certain policy, and they can send lawmakers a letter that essentially lets them know that they voted to align with a certain policy or goal. And if that policy or goal aligns with the bill, then lawmakers understand that there's the commissioner is interested in moving that forward. So the commission did signal support for veterans getting access to the program through the VA paperwork, and we're glad at MPAA to see this as it is. I think it's a good step in the right direction, and we should be doing everything we can to ensure that our program is responsive to the needs of all patients. So, if veterans can get benefit from using their paperwork at the VA to enter the program, then I think this would be a great introduction to our medical marijuana program. And one other point, I think, which is a little unrelated, but I'll just throw this in there, is that I think reciprocity is also important. Some states and patients may not have the best program, and they live near Massachusetts or travel frequently. And I think that reciprocity is also an important aspect that should be introduced to our program, as veterans could benefit from being able to use mass. So I think this is the last bill that we have on the agenda tonight, which is S62 and H105. They are nearly identical, and it's an act relative to data transparency in the cannabis industry. This one has to do with lab testing. So there's been a lot of discussion about the accuracy of lab tests. Some of us have seen the lab results of products that are in the high 30s, maybe even 40s in percentage of THC, and the commission themselves has raised concerns with whether or not there are issues with some testing going on in the state. And this is important for patients because the accuracy of the label is important in terms of dosing correctly, and patients need to understand what's in the package that they're buying. So this bill in particular would require that the commission collect a whole set of new data, and this data would come from independent testing labs. So this new data that they'd be collecting includes the industry averages and the specific results from labs for failure rates. I would also look at various contaminants, moisture content, THC and THCA levels, and total terpene levels in different cannabis products. Let me pull up the actual bill here, which I have. It's pretty extensive, the list that this bill would cover. So clearly lawmakers are interested in this lab issue, and they want to have a little bit more transparency, I think, in lab results, and that way we can all have more trust in the results. So other than the extensive list of new data that the commission would collect, it also would require that this data be housed on the commission's open data portal, so people could view the information. It should be updated on a quarterly basis according to the bill, and that the commission should investigate and publicly report any discrepancies for individual labs, and it gives them 1 year to implement these new regulations with the new law. So I think this is a good a good way to look at trying to fix the issue. Clearly we need to have accuracy in our tests, and like I said, trust the tests, be able to trust the label. And so as the industry evolves, I think it's important to update the regulations and the law. And so if this is one of the issues that means a lot to you and that you think that you'd like to see, we would encourage you to take some time to look over. The next session of this webinar is going to cover advocacy and how you can get more involved and how you can make an impact. So just checking for questions. I hope everybody's having a good put together. Out of the bills that I just discussed, we've compiled which committees that they're in currently. So H4409, H122, H4087, and H105 are all before the Joint Committee on Healthcare Financing, and the chair of that committee is Representative John Lawn, and his contact information is on the screen. But for those who the March, during April, we really need to see some of these bills. Our community is, it shows them that we're ready for change and that we're essentially trying to engage with them in order to change the law, doing it through the process that as it's intended to be. So with these bills, please reach out to this committee, and you can do so by sending an email or making a phone call, or, as I mentioned before, even sending something as small as a postcard. You can write a small message on there that they'll receive, and it will go a long way in helping them understand what kind of impact this bill will have. And if you see your representative on the list of members on this committee, it may be advantageous for you to reach out to your representative and let them know that you support the bill, so that way when the deliberations are going on, that your representative can say, I was reached out to by one of my constituents and they support this industry in Massachusetts and patient access. So the next committee that we're looking at is the House Committee on Steering, Policy, and Scheduling. The bills that made it to that committee are H4426 and H104. That committee is chaired by Representative Kevin Honan. And if you check out the Massachusetts Legislature website, or if you can see on the screen here, his contact information is there. And please feel free to reach out to the committee. I believe 4426 is the one for employment protections. And I think we can all get behind ensuring that our fellow cannabis user is not unfairly discriminated against and fired just because they use cannabis when they're not at work. Clearly we need to have our laws update with the times, and there are several other states that have legalized cannabis that do have these protections. So Massachusetts is kind of the odd one out here, and I think it's time that we really stand up for each other and push for this one. And so definitely take some time to write down this information or check it out when you get a chance and share your support for these bills. So the last committee that has cannabis bills in them is the Senate Ways and Means Committee. My mistake there. But those bills are correct. So it is the Senate Ways and Means Committee, and the bills before the Senate Ways and Means are S62 and be the case that your senator is on this list. So I believe S62 is the bill about transparency in lab testing, and I believe that 2599 is the one that has to do with seeds. So definitely take a look and reach out to this committee if you want to reach out about those bills. So it goes without saying, but you definitely want to reach out to the specific committee that the bill that you're trying to advocate for has before them. If you're reaching out to a different committee that doesn't have the bill, it won't have the intended impact. So definitely make sure you're reaching out to the right committee and be clear about which bill that you're supporting, so we can have it moved onto the next committee, because it doesn't stop once it's been sent from one committee to the other. This can continue kind of in a cycle, and obviously if we all reach out and show our support and raise awareness for these bills, it will be harder for legislators to hold the bills back. So it's definitely important that we take the next few weeks to really do some big steps for cannabis advocacy. And I think that 2024 is a big opportunity for us to make some of these ideas a reality. And some of you may have grown up listening to that Schoolhouse Rock cartoon, I'm Just a Bill. And it's definitely a hard process to get through committees and debate, and we continue to stay on the course, and we know that this is the advocacy really does work. So we encourage you to not get discouraged. We want you to work together with us over the coming weeks. We look forward to sharing some of our projects that we're working on, but let's move on to how you can really make a big impact with your testimony and you sending in message to the commission. Okay, we are so sending written comment. You can definitely send in an email, and it doesn't need to be very long. But it definitely can make a difference. So definitely take a minute to read the bill that you want to talk about with lawmakers. Get to know it. Make sure that you understand what the bill is doing. And if you have any questions, reach out to someone like me. I'm happy to kind of give my interpretation on what the law says, or kind of give you an idea of what section that it's updating. So there are people in the industry on the Cannabis Advisory Board who are happy to help. So please feel free to reach out if you have questions, but make sure that you definitely have read the bill that you're advocating for, and you've read up on what it will do. So if you're asked any questions that you can really grab attention if you dedicate one sentence in your introduction to how urgent this issue is and how it will have a real impact in your life or the life of people that you know or your community. So if you can also include 2 or 3 supporting ideas or arguments that would back up your points, of why this needs to happen and the impact it will have. Definitely include at least 2 or 3 of those supporting evidence, any data or personal experience that you have. In the end, lawmakers are people too, and our personal experiences can really humanize the situation, and building a personal relationship with lawmakers and their staff is a great way to have a relationship. You have somebody to talk to, and they know who you are, and so it's important to build those relationships. And one of the other points is to address any gaps in knowledge with correct information, and don't go guessing at things or making up numbers. If you don't know something, you can admit that you don't know it and that you'll follow up with them. It gives you a good opportunity to follow up later. and you can follow up with the correct information, and continue the conversation. And when you're sending written comment, it's important to keep the email somewhat brief. Obviously, if you want to make a compelling statement, you obviously need to do that with a certain number of words, but you definitely want to keep the message brief so they can understand pretty quickly where you're coming from and what the message is about, and they can file it appropriately as a message. But some people will say that you can only get things done with money, and that's not true. Grassroots efforts really do happen, and like I said before, when we use our voices to make sure that lawmakers and regulators understand where we're coming from and what we want, then we can actually impact people's lives for the better and make a big difference where essentially eliminating suffering and unnecessary burdens for people. So it's hard enough to get through the day-to-day life when you have a debilitating condition, and so we need to stand up for the rights of our fellow constituents and neighbors, make sure that we have the laws in Massachusetts that we deserve to have. So the best practices in advocacy, we have listed these out, and we hope that you can learn from some of these, and definitely they are helpful in making a bigger impact. So definitely make sure, like I said earlier, that when you're speaking that you're accurate and that your facts are correct. Check your facts if you need to. Don't go in there making up anything. But the next one is be vocal. Showing up is recognized. I'll tell you quickly that whenever I go into the State House or I step into a certain lawmaker's office and I say I'm from the cannabis policy, landscape, and I want to talk to them about cannabis, a lot of the times they'll usher me into a room and they want to talk. So, if you're ever in Boston and you're in the industry or you're a patient and you have a few minutes and you want to make a difference, go see your representative or your senator and speak to their staff member and let them know that you took time out of your day to let them know that certain piece of legislation means something to you, or that you want to see them support legislation that would do certain things. Because like I mentioned, you have to file the bills in January at the start of the session, which is coming up in 2025. So, you can start introducing your lawmaker to topics that you would like to see them support in the future. And, we're seeing employment protection in this session, but I think another one that we can advocate for and try to get introduced in 2025 is housing protection, so people aren't unjustly kicked out of their homes for being a cannabis user and discriminated for that reason. Being polite is another important thing. Kindness goes a long way, and like the old saying goes, you catch more flies with honey than vinegar. So you want to be nice to people, just like you want people to be nice to you. So it definitely goes a long way to being polite, and you stay involved throughout the process. So that way where the bill is, if it has moved, or what happened when. So and another big tip in advocacy is if you're ever criticizing a policy that is in place, it's really important to really think through what you think this policy should be. Offer a workable solution to the problem that you're criticizing or complaining about, because if you just complain about it, it doesn't do it. It's hard for them to understand where you're coming from sometimes. So if you are able to draft your own solution or come up with something that that works, it can often be really helpful because then they have something to work with. So now it's your turn to advocate. And I call 2024 the time for cannabis reform because we really have an opportunity. And as I mentioned in this webinar, there are bills that really have a big impact. And I hope that some of you have learned from this webinar what those proposals are on Beacon Hill and how you can reach out. I would definitely suggest taking some time over the March timeframe, if you can, to take a look at these bills and reach out to your lawmakers. A simple email or a phone call can make a big difference. If you work in the industry, talk about this with some of your coworkers or your friends. See if you can inspire others to join you in advocating for these updates. And, on top of sending these ideas to the legislature, stay in touch with the Cannabis Control Commission and make sure they know where you stand on these certain issues, because just like the legislature needs to hear from all of us, I think the commission needs to know where we all stand, and that way they can stand with us instead of us not being on the same page. So we're excited to do more webinars and do more advocacy. I'm interested to do things this year, potentially going up to Beacon Hill with some of you and meeting your representatives. If you're interested in that, please feel free to reach out to us, and let me know if you're around to volunteer, or if you're interested in helping us spread the word about some of these bills. We can really use your help, and we really appreciate your support on bills that would support patients, because at MPAA, that's what we're all about. That's what we do, and we're committed to it. We have always been on top of what's going on for patients, and while there hasn't been many updates for medical cannabis in the past few years, we did recently get an update for telehealth, which is good, but we did have to rally to get that, and so please know that we would love for you to come join us at our next rally, and we hope that we can get some of these bills passed on Beacon Hill with your support. So thank you for tuning in tonight. We want to thank you for joining us. It's really important to connect with you and to share this information, and I'm so glad that some of you have taken the time out tonight to happy to talk to you about some of these bills, have our postcards on hand, and definitely talk more about how maybe even in the new legislative session we can file bills that would fix some of the issues that we see in the industry. So we look forward to expanding patient access, improving our medical marijuana program, unlocking the restrictions that have held it back. With your support, we can make it happen. So thank you. We appreciate it. And